Good evening and welcome to I'm Listening Live. We've got a great show planned for you. We have Dr. Errol Southers and Dr. James Simmons joining us. We talk about all things mental health related, especially looking through the lens of Black Lives Matter, COVID, and always just reminding ourselves to focus on self-care. If you have a question, you can always send them to us through our Loveline DMs or by tweeting them with the hashtag I'm Listening. Right now, we are witnessing and part of something monumental. We're having what we would call the largest civil rights movement in the world. Right here, we have all 50 states and 18 countries that have participated in the Black Lives Matter protests, which is a really powerful level of really creating space, building community, and getting voices heard. Now, right now, we've definitely got two pandemics, right? We're battling COVID and we're battling racism. So it's really important from a mental health perspective that we are focusing on the impact all this is having on us in terms of our mood, in terms of us emotionally, but also in terms of the impact on our body. Our bodies are a really powerful place to check in on whether or not we're getting overwhelmed or, more importantly, even traumatized. Now, know that when we're talking about trauma, the impact isn't just on those that are victimized by actual events, it also occurs to those that are witnessing said events. And so I want everyone to be very sensitive to the way that everything that's happening around us and on the news is impacting them. I want to make sure that people aren't traumatizing themselves. But yes, we are participating and witnessing some things that for many are going to be very triggering. So I do want us to pay attention to our exposure to news, events, conversations, making sure people are setting boundaries, even giving themselves what I call a news or a phone use bedtime. That's right. About an hour before you want to go to bed, shut down all of those things that are going to make us a little overwhelmed and hyperstimulated and maybe not allow us to sleep. But I also want to call out that now is the time, if you haven't already, with friends, family members, and especially your children, starting to really talk a lot more about diversity, whether we're talking about race, gender expression, sexuality, body size. All these things are othering and often stigmatized. And we really want to start to talk about the beauty and strengths in diversity because mental health has a lot of that, as does physicality. But right now we're going to go to Dr. Errol Southers, Professor of National and Homeland Security. How are you? Welcome to our show.
I'm fine. Thank you for having me.
Absolutely. You got quite a legacy when I was looking at all the work you've done. You've definitely had your hand in a lot. That's quite a history.
Thank you. I've enjoyed it and I still wake up every day having fun.
It's a beautiful thing to be able to say. I hope I can say that at the end of my career a few years from now. Let's jump right in and just talk about policing, strategies for improving policing. There's a lot of people that aren't sure that that's even possible. So what would that vision or outcome look like?
Well, the first thing I want to say is that people are tired of talking and they're tired of hearing law enforcement agencies say we need more training. So as someone who's been in 3 law enforcement agencies, 2 at the local level and 1 at the federal level with the FBI, I got to tell you that this is about a culture change. And culture change starts at the top. So as we talk about a framework for healthy policing, I think it's really important that we think about first, who are those chiefs? Who selects chiefs? Well, mayors. And if mayors aren't selecting the right person, you're not going to have any changes in that organization. Secondly, officers come into the department through the academy. That's where it has to begin. So at the top and at the bottom, that's how these reforms have to take place. I think what people really have to understand, and what meaning that by people I mean law enforcement agencies, is that we've got to go back to basic humanity, treating people with dignity and respect. There's really no need to reinvent the wheel here. The last administration had a 21st century task force on policing and had 6 pillars which they addressed that are really critical. And I'm hoping that as we go through this process now, because of Mr. Floyd, that agencies will do that and they won't make that biggest mistake of deciding to self-assess and reinvent themselves and make the same mistake over again.
Now, when you talk about bringing back the humanity, which I think is a really stunning perspective, where would you say we initially went wrong? Is it just an outcome of, general racism in our culture and systemic racism and inequality? Is it that, how did we get away from the humanity piece?
Well, part of it is cultural. Law enforcement officers are in a paramilitary organization. They've taken on more of a warrior mentality instead of a guardian mentality. Having done that, they've now decided it's us versus them. They look at everything as conflict. I always jokingly say, look, they don't call police officers because something good happened. You call firefighters for that, okay? You call police officers because something's wrong. And so it starts right there. And in doing that, they become very protective. The humanity goes out the window. Everything is strictly business. They've lost their relationships. They've lost a key component of their real task, which is embracing the community. And I think that's what we have to go back to, treating each other in the department as we would treat each other outside the department, and remembering that they really are there to serve the people.
Yeah, and also just looking at some people's writings on reform of the prison system, but also the policing. I noticed that Denver is launching a new pilot program where they're going to actually try to have social workers to handle things that maybe fall more into their purview, such as people that are struggling with mental health issues. So do you think part of the problem is also putting on the police roles that they shouldn't have put on them?
Well, I'm glad to hear you say that. And I do want to say that LAPD, the Los Angeles Police Department, does have social workers who ride with those officers and they're on duty. Police officers are social workers. We get called, so by we meaning my past career, they get called for everything. And so they do have to be somewhat of social workers. But I want to say this, in being somewhat of a social worker as a law enforcement officer, there comes a time now we have to incentivize those things that we weren't traditionally trained to do. We've got to start incentivizing de-escalation. We've got to start incentivizing not arresting people when we don't have to. And that's what I'm talking about when I say getting back to treating people with dignity and respect. I was a gang officer for years. I never took a gang member to jail and disrespected him. That's really important. And I think that's what we have to get back to. There are some bad people out there. Some people have to go to jail. They don't have to be disrespected, and in this case, killed in the process.
Yeah. I mean, there's nothing rehabilitative in that. And I think as a therapist, that's what I'm always looking for is how can we not punish, but how can we transform and heal and bring the collectivity back together?
Mm-hmm. Absolutely.
So within the police department itself, what are your thoughts on officers holding each other accountable and maybe trying to kind of call out the more problematic ones or kind of, I guess more accountability with it internally on that level?
That's a huge pillar in reform, and I'm glad you brought that up. Officers have this code of silence, and they adhere to it. I think we've got to make sure that they know that they can come forward when there's an officer who's bad. They also have to be protected when that happens. With all due respect, police departments are just like schools. If you go to a school and ask the kids who's the bully in the class, they don't have to think twice about it. If you go to police departments and ask who the problem officer is, they know who it is. So with that, I'll also say two other things. Number one, there's got to be a process of making it easier to terminate bad police officers. I was on the board for a police union. I've been sued by police unions. It's really difficult to get rid of a problem officer, and that is part of the problem. The other thing I would say is that when an officer is terminated, especially for excessive force, deadly force, harassment, sexual harassment, or misconduct or corruption, that information should go into a national database to ensure that that officer never works in public safety again in this country. We don't have that. We need to have that.
Okay. That's a powerful statement and possibly a powerful determinant if it's going to be carried with you for the rest of your career. I'm on board with that. Let's talk about some of the moves that I'm hearing made here locally. Mayor Garcetti was talking about cutting the LAPD budget and then reinvesting that money in communities of color. What are your thoughts on that?
I think that's a great and noble concept. Having been an assistant chief of police, let me speak from a budgetary standpoint. If I have to cut $150 million from my budget, and I'm Chief Michael Moore, I'm going to look at what I consider, quote unquote, those non-essential services that I'm providing, because I'm not going to cut my personnel. I'm not going to cut my equipment that I need for my personnel. So now I'm talking about things like perhaps the cadet program, the Explorer program, midnight basketball, the Hero and You program that we have for the K through 12 kids. Unfortunately, when you do that, you cut off your connection and relationship with the community. And more importantly, you now have taken away that pathway of those young kids who are tomorrow's police officers because of the relationship they've had with your departments throughout their lives. This is a really huge move. I work very closely with Chief Moore. I work very closely with Mayor Garcetti. I hope that they will think this through and it will be done correctly. But when I hear cuts like that, I think about services that people don't think are real police services, but they are. And who gets hurt in that process? The community we're trying to enhance. So this is going to be very, very complex. It's going to take a lot of thinking.
Okay, so what I'm hearing is, although redistributing money to communities of color in an isolative way, that's powerful. But as you're saying, if we're trying to reconnect the community to the police force, we don't want to remove the programs that allow that bridging to happen.
Exactly. And
Okay.
we put those programs in there in the first place to do exactly what they're doing. Now, if I've got a cut, that's going to be the first thing on the list.
It always tends to be, because I immediately went to just the arts and music programs being cut from schools. And I guess what's concerning is, on a psychological level, I know that it's going to take a lot of time for people to have the needed corrective experience of police officers. You know, I'm white and I'm pretty privileged, and I've started to internalize some anxiety myself around police officers. And so I can only imagine what that's like for Black people or people of color. So, I mean, it's going to take a long time to have a new experience of each other.
Absolutely. And we don't want to do anything that suggests that we're not supportive of the community. Let's just think about this for a second. Some of the programs I just mentioned, what happens when those programs get removed because of a budget cut? What you're signaling to me, the community resident, is that I'm not important anymore. That program's not a priority for you anymore. And you lose my support. I'm not paying any attention to the budget you have to cut. I only know that my kids got to go to the after-school program with Officer Bob every day, and now he's not there. Or they used to go to midnight basketball with Officer Jane, and she's not there. Now you start to lose my support because you've taken away some of our resources, and our relationship changes, and not for the better.
Wow, well said. The relationship on both sides needs to heal. I was digging around in some of your work and in some of your lectures, and you pointed out something powerful that I had not read or seen yet, that by 2045, it's projected that we might have a majority minority-based country. Talk to us about that. That was huge.
Well, it's quite interesting. As you know, I work in the area of violent extremism. And several years ago, it was projected statistically that we would have a majority minority country by 2050. It's been recalculated in the last 2 years to 2045. That's what's fueling a number of extremist organizations in this country who believe that there's some real movement here of what they call white genocide. In fact, if you go to some of the hate organizations and extremist organizations, you'll see that if you see the term diversity, that to them equals white genocide. So what they're doing now is pushing back. And that's why you're seeing a lot of the anti-immigrant movements. You're seeing hate crimes now related to COVID. We have a link to our site called Virus of Hate. We are tracking, believe it or not, COVID-19 related hate and extremism targeting Asian Americans and targeting Jews. The anti-Semitism and hate crimes against Asians are at an unprecedented rate because they are being deemed responsible for COVID-19 being in the United States. So it's all based on, again, the fact that they feel that these minorities who've come from other countries, in the case of Asians, are the cause of us being in the pandemic. And the Jews, in their minds, are actually guiding this pandemic to make people sick so that the government can do things like stay-at-home orders, wear masks, and other overreach to make us more contained and constrained in our daily activities.
Oof, you know, psychologically speaking, and even biologically speaking, we welcome diversity. We see the beauty in it, the strength in it. It's creative. It's fascinating how us humans, we can't stand that. We just want to conform and whitewash everything.
Exactly. We want to make it, very absolute, us versus them. As you know, there's a whole contagion of called otherism, where I want to blame it on another race, another religion, another ethnicity, the other gender in some cases. It's never about me. It's always them making me a victim. And that's what's fueling this. And unfortunately, again, we've got to bring back some humility. We've got to bring back some humanity if we're going to survive as a country. And if we're going to survive at this point as a species.
Yeah. And I can't, yeah. I mean, so I'm happy to see the shifts that are happening. So I guess in closing, are you feeling good about this new wave? Do you think it's going to sustain itself, or do you think that this is a bleep on the screen?
I will say this. I'm going to be as optimistic as I can, but I'm going to say this. The death of George Floyd is a game changer. There's not a police department in the country that's going to operate next week the way they did 2 weeks ago. If they do, then they deserve what happens to them. This is going to change relationships in our country. It's going to change activities in our government. I think it's going to change the way we do a lot of things. And I hope it's for the positive. I hope that we don't run this course again. Unfortunately, it reminds me of another area that we focus a lot on, which is school shootings. We always say we're going to do something. We're always going to be very aggressive and progressive, and it goes away until the next one. I hope there's not a next one. And I hope that, unfortunately, if and when there is, we have made tremendous progress in restoring humanity and humility on both sides of the divide to make sure that we can do the right thing to reduce the risk of this happening again.
All right, Dr. Errol Southers, thank you so much for your time.
Thank you for having me.
Have a beautiful night.
You too.
There we go, folks. Let's let this movement be a true movement and create true sustainable shift. And as we keep talking about, look, all these different levels of othering and stigmatizing and prejudice, they all intersect. It's all, as we were talking about, this idea of having to always construct this us against them. So much work to do, but again, pick one level of oppression, work on it, whether it's body shame, racism, homophobia, it all comes together in the end. We got a lot of work to do, but I think it's all about finding sustainable solutions because I don't want us to find ourselves back in the same place. So the COVID pandemic maintains itself. Let's go now to Dr. James Simmons to talk about those intersections. Dr. James Simmons, how are you, buddy?
Why? Hello, Dr. Chris. How are you?
It's good to see you. Welcome back.
Thank you very much. It is good to see you as well in these very interesting but necessary times.
So let's jump in. In the U.S., 21,000 new cases. Now, what are your thoughts on this one? So is it the mass protesting to blame, or is this a result of, privileged Memorial Day, kids in the pool / reopening too soon? What are your thoughts?
So if you just look at how the disease spreads and sort of how we've seen the numbers that have gone with new cases of COVID-19, you would expect that this would likely be from Memorial Day and the fact that there are new cases now that we're starting to see that. But it's very interesting. As we've been saying from the very beginning, there's so much about this virus that we just don't know, and it doesn't behave in very typical ways because there are also states that have reopened sort of in a systematic approach, and some of them less than others, who are not seeing the spike in cases that we thought. Now, some of those states had lower numbers of cases in general. Some of those states have also encouraged, those with underlying health conditions and the elderly to still stay at home. And we know it's very well documented that those groups are at much higher risk. So it's very interesting, but I think any sort of spike that we're seeing right now is related to Memorial Day versus a potential spike that we might see 7 to 14 days from now from the protests.
Yeah, that was my I took pause too when I saw people saying, well, these cases, it's the protesting. And I was like, okay, we got to look at timeline here to get a little clarification. I thought this was really interesting as well. I had not considered this impact or this intersection. So there was a headline and it said that public health experts have gotten together and they believe that we need to keep protesting in service of ending the pandemic because the COVID infections disproportionately burden the Black community. And that itself is because of the racism that the protests are themselves trying to dismantle. Weigh in on that.
Oh, that's a lot, isn't it? So, these protests obviously sparked by the murder of George Floyd and police brutality in general, but also really getting at systemic system racial issues, which are so present in healthcare. I mean, they're present in really any setting, but heart disease, cancer, stroke, asthma, diabetes, influenza, pneumonia. African Americans are disproportionately impacted by those and have a higher mortality rate from all of those than any other racial demographic group. And so when we talk about these things, when we talk about racial injustices, we talk about them on a macro scale and micro scales, and it certainly impacts the health community. So on one hand, it's really important to continue protesting, to continue bringing awareness to these things, because we have to make change in a healthcare environment for the overall health of the Black population going forward. At the same time, as a public health person and as a nurse practitioner, I'm wanting to tell everyone, wait, don't protest, because this disease is disproportionately impacting Black individuals and other individuals of color. And those are, by and large, the majority of individuals who are protesting, though you see lots of white individuals protesting. I think the issue here, though, is what's so interesting is that there's a lot of confounding factors. So the protests are happening outside, and you do see a lot of people wearing masks, which is really, really great. We know that this is a droplet transmission, but the protests are happening outside, and so you have much better airflow. So where we say that 6 feet, you need to stay away from someone, it might not be necessarily quite as important because you're outside and there's airflow. At the same time, think about a protest and think about what you hear at protests. People are chanting and they're screaming and they're talking. And so all of this is coming out, whether you're wearing a mask or not. If you're closer to someone, it increases your chance of potentially catching it from someone. And on top of all of that, younger individuals who we know are less impacted from a mortality standpoint from this, but they also tend to be the asymptomatic spreaders, meaning they don't even know they have COVID-19 and they're very contagious if they've been contracted with it, and then they spread it to others. And lots of communities of color, Chris, have multi-generational family systems that all live together.
Okay, so James,
that concerns me.
So where are you leaving us with that? I don't know where to land with that.
No, it's a lot. It's a lot. Well, because I think what happens is then you have individuals who maybe they're young and healthy and they're protesting, but then they go home.
That's right.
And they're living with grandma and grandpa.
And these are the questions that are coming into my practice is we're assessing levels of risk and we're looking at who are you living with, what health factors do you have? And in the end, they're left deciding for themselves what level of risk they want to take. And we talk about all the different ways that someone can be involved in the protests and Black Lives Matter. And for some people, it is necessary that they sit out and don't necessarily protest in the streets. Is that what you're saying as well?
You know, it's a really difficult conversation because ultimately, you know, if someone has a really significant underlying health condition, which, as I just said, disproportionately impacts the Black community, my gut is to recommend that those individuals not protest. Okay. But as a Black queer man, I also know that we have to protest, and now is our time to act. I mean, Dr. Southers, who is an unbelievable individual, he's fantastic. You know, he's saying this is a moment, right? He said it right there, and he represents a side of law enforcement that's really trying to make change. But everyone understands that this is the moment that we need to take advantage of, including someone who is so passionate about health that the community has to protest that. It's if I had a perfect answer, Chris, I would have a perfect answer.
But that's such a beautiful answer because it really speaks to the power of the different identities and positions that we socially occupy. You know, on one hand, myself as a professional, I want to give the public health answer and I'm like, don't take those risks. But then you're right. Mm-hmm. The social justice person in me wants to say, get the hell out there and get those signs ready. So I appreciate that distinction.
Yeah. And it's a difficult one because I do get asked this question quite often. You know, I have pretty severe asthma, but I want to go protest. I want to go involve. And so, you know, I think that there are all the different ways that we've sort of talked about it. I know you brought up before that there are other ways that you can get involved in protest. If you really do have a significant underlying health condition, or you are a caretaker of someone who is older or has a significant underlying health condition or both, you know, I don't recommend, we're still not there yet. We are still in the middle of a global pandemic, and I don't recommend being in large crowds if you're one of those individuals, but you can still get involved in the movement in a different way that doesn't mean being around a lot of people.
Okay. And so can I take that and run with it and assume that you're also going to say, even though the warm weather's here, the summer's here, cities are opening up, still take precautions and maybe sit it out?
I think so. Yeah. You know, it's in LA, you know, they just announced yesterday that the Los Angeles Pride parade that was initially canceled has now been changed, and it's going to be a march in conjunction with Black Lives Matter. And even then, you know, it does concern me for a lot of individuals who are at higher risk, but who are like, okay, I'm going to that now. This is something that I can do. It's something I can look forward to. It's a way that I can contribute. But ultimately, I think if you have a really fantastic conversation with your primary care provider, whomever that is, you know, we've talked about this before, Chris, keep lines of communication open with that individual and say, you know what, I've been really good. I'm staying at home. I have no symptoms. I haven't been around anybody, but this protest is meaningful to me. Doing this is something that's really, really important to me, and have the conversation. It's not going to be a black or white answer. It's going to be gray depending on the individual.
Well said. All right. Dr. James Simmons, thank you so much for being a part of the show, and be safe out there.
Thank you very much. You too, Chris.
Have a great night. Tough decisions we all have to make. We all have to consider who we're impacting, our health risks, and also what options are available to us otherwise. And I'm thankful that we have a lot of different options available. But definitely, please continue to consider that the COVID pandemic is still happening. And we want to participate in all of these protests and the revolution as it's needed. But also consider your health factors and your health risks. It's going to be different for everyone. At the end of the show, we're going to put up some resources for those that need some extra care and support. Please utilize them. Otherwise, all of our old shows, you can go to the radio.com handles and check out past episodes. We'll be back next week, 5 p.m. I always mess that up. 5 p.m. Pacific, 8 p.m. Eastern. God bless that time. As always, thanks for hanging out with me. And you all have a beautiful, beautiful night.